I'm Dr. Holly Russell. I'm the Medical Director for Clinical and Community Programs at the Center for Community Health and Prevention. Today, we're going to talk about safe alcohol use. For many, there's nothing better than a cold beer or a frozen cocktail on these hot summer days. But it can be easy to slide into bad habits this time of year with alcohol use, especially during this current pandemic when many of us have been home, bored, and perhaps a little more anxious than usual. Additionally, many of our summer events, including holiday parties and barbecues, revolve around alcohol use. Sometimes people are surprised to learn what counts as a standard drink. In the United States, we define a standard drink as any beverage containing 14 grams of alcohol. This is also sometimes known as an alcoholic drink equivalent. Some examples of this would be 12 ounces of regular beer, which is usually around 5% alcohol by volume, 5 ounces of table wine, or 1.5 ounces of distilled spirits or hard liquor. Although those drinks I showed you were all different sizes, each contains approximately the same amount of alcohol and counts as one standard drink or one alcoholic drink equivalent. Those are just a starting point for comparison. Many different types of drinks have different alcohol contents. Light beers, for example, have almost as much alcohol as regular beer, but people might drink them thinking they're getting less. Alcoholic sparkling drinks have become very popular recently. This spiked seltzer is 6% alcohol by volume, so one of these 12-ounce cans is actually about 1.25 standard drinks. These can also be high in calories and sugar content, so you want to make sure to take a look at the label for that as well. Some of the double IPA beers, which are really popular, have as much as 8% alcohol by volume, and they often come in these larger cans. If you drank one 16-ounce can of this 8% beer, it would be the equivalent of 2 standard drinks. If you want to know the alcohol content of a canned or bottled beverage, and you aren't able to find it by looking at the label, or if you're drinking a cocktail and you're not sure how to do the math, there's actually a calculator you can use at the website at the National Institute on Alcohol Abuse and Alcoholism. The most recent dietary guidelines for Americans defines moderate drinking as up to 1 drink per day for women and up to 2 drinks a day for men. And of course, we're talking about adults of legal drinking age. When we think about binge drinking, we mean a pattern of drinking that brings the blood alcohol concentration to 0.08% or higher. Practically, for a woman, this means in a 2-hour period, drinking more than 4 drinks at a time, or for men, more than 5 drinks in a 2-hour period. Heavy alcohol use is defined as more than 4 drinks on any day for men, or more than 3 drinks any day for women. Well, studies show that women start to have alcohol-related problems sooner and at lower drinking levels than men for multiple reasons. On average, women weigh less than men. Also, alcohol resides predominantly in body water, and pound for pound, women have less body water than men. This means that after a woman and a man at the same weight drink the same amount of alcohol, the woman's blood alcohol concentration, or that BAC, the amount of alcohol in your blood, would tend to be higher, putting her at greater risk for harm. Drinking can cause a number of health problems and is associated with over 200 diseases and injury-related conditions. Studies have shown that for women, as little as 1 drink a day increases the risk of breast cancer. Many people know that alcohol increases the risk of liver disease. However, it might surprise you to know that it can also increase the rates of cardiovascular disease, depression, and stomach bleeding, as well as certain cancers including mouth, esophagus, liver, and colon. If you are worried about your alcohol use, please see the Rethinking Drinking website at the National Institute on Alcohol Abuse and Alcoholism for more information, or reach out to your primary care clinician to learn more. I hope you can enjoy your beverages and keep these tips in mind. Here's to a safe and healthy summer.